Well, a person in Washington state has died from coronavirus, marking the first confirmed coronavirus death in the U.S. This as the number of cases in the U.S. reaches 71. As Melissa Rainey reports, the White House has announced new travel restrictions because of the virus.
Saturday, health officials in Washington state confirmed the first death in the United States from the coronavirus. The CDC says it may be a case of community spread, not travel related. Fears of a widespread outbreak across the country are growing. Retailers like CVS and Walgreens say they've noticed increased demand for hand sanitizer, cleaning wipes, and face masks. President Trump says he will meet with pharmaceutical companies on Monday to talk about developing a vaccine. He says the administration is prepared.
Tremendous amounts of supplies are already on hand. We have 43 million masks, just far more than anyone would have assumed we could have had so quickly.
Vice President Mike Pence is heading the White House coronavirus response. Saturday, he announced new travel restrictions for Iran and an advisory for parts of Italy and South Korea.
The President today has authorized the State Department to increase the travel advisory for Americans to level 4. We are urging Americans to not travel to the areas in Italy and the areas in South Korea that are most affected by the coronavirus.
The Centers for Disease Control and Prevention says the best way to combat coronavirus is by washing your hands thoroughly with soap and water. I'm Melissa Rainey reporting.
And while this is the first death in the U.S. from the coronavirus, it is not the first death of an American. A U.S. citizen died earlier this month in Wuhan, China, where the virus first appeared in late December. Katie Steiner continues our team coverage from the newsroom with what a local infectious disease expert has to say about Minnesota's readiness. Good morning, Katie.
Good morning, Esme. Well, we talked to the director of infectious disease research and policy at the U of M. He told us not to panic. However, he did say that this disease is going to spread fast, and that said that every community will be hit. He told us that we have to keep the big picture in mind here. 80% of all of the cases that we will see will be mild with zero hospitalization. That means 80% of the people that get this and have symptoms won't even need to go to the hospital. 20%, he said, will be hospitalized. 5 to 8% could have very severe cases, and 2% of the people who do get this could die from this virus. Now, most people that have passed away have been older with prior health complications. Right now, there are no confirmed cases in the state of Minnesota, but Dr. Osterholm said that that will change, and he thinks that Minnesota is very prepared for this virus.
You have to have faith in your government at this point, and I'm actually confident the state of Minnesota is probably going to be one of the most prepared states in the country. The governor, the commissioner of health, and others have all been very involved in doing what we call basically preparedness planning.
And we also talked to Senator Tina Smith yesterday about preparedness at the national level, and she wants to see Congress approve more money for the country to get prepared.
So I'm concerned that the requests of the Trump administration have been too low. Even Republicans would agree with us Democrats that the $2.5 billion that he suggested is not going to be enough to ramp up the preparedness that we need.
So how do you and your family prepare? Dr. Osterholm gave us a couple of pieces of advice. He said, first, now would be a good time to stock up on all canned food items, especially if you don't want to go outside and limit your public exposure. The other thing he talked about was if you need a prescription, that might be a good time to stock up on all of those things right now. Esme?
All right, Katie, thank you so much.